Hi, everyone, and welcome to This Is Your Time. For those of you who don't know me, my name is Donna Levy. I've been a registered nurse for 38 years, mostly in brain health and mindset, but I've taken care of the whole body because what's good for the body is good for the brain. And today I wanted to talk a little bit about the journey that I've been on for the past 5 months. But actually, it's been about 20 years that I've been on this journey. It is the healthy living, not struggling with weight management and feeling great and having longevity. So, what is the secret of all of that? Well, I have found several practitioners, both in the medical field and in the fitness, health and wellness, basically biochemical field, to figure out what was going on with my postmenopausal body. I had told a trainer a long time ago, I had one before I got married, and I said to Ophir, he was Israeli, I said, look, if you figure out what's going on with menopausal women and how to fix this, because we struggle so much with weight gain and, then we're getting diseases, we get wrinkles, all kinds of stuff, you would be a multimillionaire because everyone would go to you. So over the past 5 months, I have started a weight loss journey, a health and wellness journey, because I know that as we carry weight, we are at risk for heart disease, diabetes, type 3 diabetes, which is dementia now, and all kinds of illnesses of the body. So what I found was a person, Thomas DeLauer, who's in one of my companies, who lost 100 pounds. So I said, well, he must know a little bit about what he's doing. Oh my God, does he know? So I started watching him, watching all of his videos, figuring out what worked well for me. I found out I was insulin resistant and I kind of had metabolic syndrome also, because my sugars were going up, my blood pressure was going up, and if you have a couple of those, high cholesterol, then chances are it's because of the sugar in our diet. And yes, I blame the society and the government for tainting with our food and basically putting a drug that has addiction worse than cocaine in our food. And that's why everybody is getting diseases. I think of my clients who's had amputations, who have gone blind, who have been on kidney dialysis, who passed away because they followed a normal diet. They followed what the doctors were telling them and prescribing. And the doctors' hands were tied because they needed to follow the FDA guidelines, okay? So now we're finding out all of these benefits to our body by being on a low-carb, higher fat, medium protein diet and getting rid of all of the excess sugar, excess carbohydrates, excess, additives. The reason why we have so many additives is it feeds our economics. High fructose corn syrup, we cannot digest. We store it in our fat cells and it causes inflammation in our body. And when we have inflammation, we have cellular damage and we have disease, okay? We don't take out the high fructose corn syrup because it lets the food stay on the shelf longer, and we raise corn. So our whole economy is fed by that, even though we are getting diseased from it, and they won't take it out of the food because our economy. And the same thing with wheat and the same thing with sugar. Sugar is the #1 culprit because they started taking the fat out of the diet and they added sugar. Now sugar is worse because sugar is just as bad, but it's addicting. in our brain center, our addiction center. It causes a dopamine response. And we want more and more and more. Our sugar goes up, our sugar goes down. We want more and more and more. Our sugar goes up, our sugar goes down. That's like the Lay's potato chip commercial. You can't just eat one, and you can't. You can't physically. You can't just eat one. Okay. So I ventured out. I started following Thomas C. Lauer. Then I started following Dr. Berg and Dr. Fung, which they're kind of all together. They speak at each other's events. They do podcasts together. Dr. Fung is a nephrologist who actually turns back the hands of time and turns back diabetes type 2, which causes a multiple of diseases just by decreasing your sugar and the times you eat, because every time we eat, our insulin level goes up, and that is the fat storing hormone. So we're storing our fat and we're not really using it. Our fat on our body is made to produce energy. It's not there, to pad our butt or to give us larger breasts. It's there for us to use as energy. And the way we eat, where 3 meals a day became 6 meals a day, we never tap into that. If you eat 6 times a day, you will never tap into that stored fat for energy. So I started doing intermittent fasting along with healthy keto. This is not keto like what we were thinking 10, 15 years ago, where keto was McDonald's without the bun. It's not. It's organic. It's healthy. It has vegetables to it. We use healthy fats, and we're able to tap into our fat stores and have a normal weight. And fasting is amazing. We heal our body with fasting. We fast for all kinds of things. We fast for religious observances. We fast for our colonoscopy. We fast for blood work. We fast when we go into the hospital, we have something wrong with our gut. They make us fast. Why? Because we have to give our bodies a rest and a chance that it will heal itself, and it will heal itself. We can even make telomeres elongated. If you fast 72 hours or more, you can make stem cells. If you're fasting like 40 hours, in a day, over a 2-day period, you could start generating stem cells to heal your body. You heal your gut, you can heal your liver. We know we can make new brain cells even. The body is amazing if we let it do what it's supposed to do, guys. So exercise comes into play just to give us muscle tone and to try to, keep the muscles that we have. We also increase human growth hormone when we fast, so we do build muscle. It's a fallacy saying you're going to eat away at all your muscle, because our body's smarter than that. We don't do that. Now, the only people who shouldn't be doing this are children, because they really need a lot of calories to grow. Pregnant women who's filled with HGH already and who are growing babies, and nursing women. Now, if you have something like cancer, go over it with your physician. Any type of medical condition that you have, you can ask your physician. But for 99% of the population out there, fasting is safe and very effective. And whether you want to do a Mediterranean keto or a vegan keto, you can do it and have great results. So I don't know why anybody would not want to do it. I don't know any overweight person who enjoys being overweight. None. Not one. And I've taken care of over 30,000 patients and helped them get on their way to health and brain health and to live a happier life. And not one of them would have said, I'm happy or fat. So, I mean, the choice is yours. There are tons of videos out there. I have a Facebook group, a nurse's take on today's health. I also have a group, Smashing Insulin Resistant After 40, and you don't have to be 40 to have insulin resistance. We get that over time, you know, because we've had high sugar and high additives and high carbohydrates, of which our body really does not want. And they're even associating breast cancer and polycystic ovary disease with too much sugar and carbohydrates. And I hate to say it, but it is our food industry that is making us sick and fat. So anyways, that's it for today. Please instant message me if you have any questions about this. I am coaching 10 people now on it, and it's free of charge. I just absolutely love being helping people, and I'm really passionate about people taking their health into their own hands, and we have a choice. We absolutely have a choice. So it's totally up to you. Don't be afraid, because most people are afraid, and that's what keeps them at bay. You know, our subconscious mind wants to keep us status quo because it doesn't want to be, doesn't want to feel any uncomfort. So, but you will be happy if you start this journey with us. You will be so happy and thrilled with your body, and your mind will thank you. So that's it for today. Have a great day, and always be blessed and be healthy and wear your mask. Okay, bye-bye.